How should you interpret hepatitis B serologies? The first thing you should do is look to see if the patient has a positive hepatitis B surface antigen. If the surface antigen is positive, the patient probably has active disease. You should confirm this with a hepatitis B DNA. The next thing you have to do is determine whether the patient has the wild-type virus or the pre-core mutant virus. The wild-type virus should be E antigen positive and E antibody negative. If the patient has long-standing disease, they've probably gone on to form a pre-core mutation, which is E antigen negative, E antibody positive. Regardless of whether it's wild-type or pre-core mutant, DNA will be positive and the surface antigen will be positive. Next, you should know what are the guidelines to initiate treatment for each of these two categories of an infected patient. If the patient is wild type, then you treat if the hepatitis B DNA is greater than 20,000 international units per ml, and if the ALT is elevated. If it's a pre-core mutant, it's slightly different. Again, the ALT should be elevated, but your threshold for treatment is reduced by a log to 2,000 units, international units per ml. You have to make sure the patient takes their medicine every day, because if they're not, then drug-resistant strains will form. Lastly, you should always think about hepatitis B in pregnancy. The two medications that can be used both begin with T. You can look those up on your own. And at the time of birth, the newborn should receive the hepatitis B immunoglobulin as well as begin the 3-part series of vaccinations. Good luck.